everyone, you're watching Voice of South Asia. This is Health Talk with Nausheen Mulbrad. क्या आप जानते हैं कि 4 साल की उम्र तक पहुंचने तक हर 4 में से किसी एक बच्चे को डेंटल कैविटीज ज़रूर होती हैं, जिसका ये मतलब है कि ना सिर्फ उसका बेबी टूथ ख़राब होता है बल्कि उसके नीचे बैठा हुआ परमानेंट टूथ यानी अडल्ट टूथ भी ख़राब हो सकता है। बच्चों की डेंटल केयर कैसे करनी चाहिए, उनको किस उम्र में डेंटिस्ट के पास जाना चाहिए, इन्हीं सारे सवालात के जवाब जानेंगे आज हम डॉक्टर अभिषेक भौमिक से, जो कि इस वक्त हमारे साथ मौजूद हैं। हेलो डॉक्टर, हाउ आर यू?
I'm doing well. How are you doing?
गुड, थैंक यू फॉर कमिंग टू द शो।
Of course. Thanks for having me.
डॉक्टर अभिषेक भौमिक का हम आपको इंट्रोडक्शन देते चलें। Doctor is the owner of Stonebrook Pediatric Dentistry with a specialized training in children with special needs. Doctor, I want to know, how commonly do you see children with dental cavities?
About 1 in 3, I would say. At least in my office, I see about 1 in 3 kids that get dental cavities.
Okay.
Yeah.
And what causes the cavity? Is it food? Is it lifestyle?
So
or
it's definitely a combination of factors. Hygiene is one of the main important things, brushing and flossing. Diet, the type of food and snacks kids are eating.
Okay.
And then there is a genetic factor definitely with cavities. I think if parents have had cavity issues as kids, sometimes kids get some of those genes, and our spit makes a big difference too. Some kids don't clear away.
did you say spit?
Yes, our
Oh,
saliva.
wow, okay.
Yeah. So our saliva genetics makes a big factor too,
Really?
whether we get cavities or not. So
Interesting.
I
didn't
could
know
go
that.
on for hours, but yeah, to answer your question, there's a lot of factors
Okay.
that causes cavities.
Okay.
Yeah.
And how do you treat cavities?
So there's different ways. It depends on how small or how big the cavity is. If we can diagnose and catch the cavity early on, fortunately now there's a lot of non-invasive techniques. One of them is a medicine called silver diamine fluoride, which I routinely use, and it's very easy to apply. We just pretty much brush and floss it into wherever the cavity is. And the other side of things, when cavities are really big, sometimes kids need dental crowns, and they need a little bit more extensive treatment. So there's a variety of treatment options. A lot of it just depends on the size of the cavity.
Okay, so let's
Yeah.
talk about dental crowns. What do you do? Like, what is a dental crown?
Sure. So though, whenever cavities are so big that it involves multiple surfaces of the tooth, so imagine there's the top part of the tooth, the side of the tooth, the front of the tooth. If the cavity is so big that it entails multiple surfaces, a filling is not the best treatment option. And any board certified pediatric dentist is going to agree with me on this.
Okay.
Fillings over time, they just tend to fracture and they wear away, and they don't hold up till the tooth is ready to fall out. Most baby teeth, especially our back ones, we need them around till about 11 or 12.
Okay.
So if a cavity is really big, it
And
entails...
it's a pretty long time, actually.
Yeah, it's a very long time.
Yeah.
So if a cavity is really big, it entails multiple surfaces, then a full coverage crown, so material that covers the entire tooth, is the best treatment option.
Okay.
And it's going to last the entire lifetime of the tooth, and it's going to allow the child to eat and without having a toothache. And most importantly, it allows for the adult tooth that's sitting right underneath the baby tooth to
Right.
grow in healthily. And then when it's time for the baby tooth to fall out, the tooth and the crown fall out together. So
Okay, so you don't have to go to a dentist to take him out before.
no. So that's the difference between pediatrics and adult dentistry. A lot of it isn't as, I should reword this. It isn't as complex,
Okay.
but our main goal is to manage anxiety for children.
Right, absolutely.
And the dental treatment itself, we just have to make sure the work lasts till 11 or 12, essentially, right?
Right.
So hopefully that answers your question. It's a full coverage crown that covers the entire
Right.
surface of the tooth.
Right, so does
Yeah.
it look like a normal crown, like an adult crown, or it looks different?
Yeah, so there's multiple options.
Okay.
One is the traditional silver crown, which has
Okay.
been around for a very long time. So that option's there, and the other, there's now cosmetic aesthetic options, and I do some of those procedures. So one is a ceramic crown. A brand name is Sprig, and I love this option because it provides the most natural looking smile.
Okay.
So I usually recommend this option if the cavities are in the front teeth, and for the back teeth, depending on how big the smile is, sometimes I'll recommend the white crowns or the silver crowns.
Right. So my next question would be, what if the cavity is just small and it doesn't require a crown? So
Yeah, absolutely. So if the cavity is much smaller, say it's on a single surface, then we could do something more conservative, like a filling. So it's a biocompatible material, and the way it works is I would clean it out with our drills, and in pediatrics we call it a water brush.
Okay.
So and we clean away the bacteria, the cavity, and then we put the biocompatible filling material in it.
Okay.
and we check the bite to make sure the kids can eat. Yeah.
Okay, awesome. What happens, this is a golden question, what happens if you leave it untreated for a long time?
That's a great question. I get that all the
Thank you.
time. Yeah. So cavities will essentially grow. You know, it's bacteria, and they're trying to get to eating anything that's on the teeth. So eventually the kids will have a dental infection. It's called a dental abscess, and that's very painful for kids. And depending on the location, it can be something very severe. So for example, if it's on an upper tooth, it can turn into a big abscess infection, which could potentially get into the eye or the nose or the sinuses. Or for a lower tooth, it can get into the neck or compromise the airway. So it can become a very serious issue. I hope I don't scare parents when I say this, but these things happen pretty quickly in pediatrics. Their bone is soft. It's not like us adults, our bones are more dense. So for kids, with this bacteria, it grows and grows. It can spread to multiple teeth and
Much faster than
adults. Yeah, the baby teeth aren't as strong as adult teeth, so the enamel's weaker. So bacteria tend to break down the teeth a lot faster. Within 6 months to a year, cavities can progress pretty quickly. Yeah.
Right. Well, that's good to know. Next question would be, what age should parents start brushing their kids' teeth?
As soon as the first tooth comes in. And what I personally recommend is start brushing when they start teething. So if you have a finger brush, you can start massaging their gums, and a good place to start is those bottom front teeth, those gums in the front. And by doing that, you stimulate the teeth to come in faster, and you're making sure that there's no plaque or bacteria in the way that can affect as those teeth are coming in. Because believe it or not, some kids start getting cavities as soon as those teeth are erupting in.
Yes.
The first 2 teeth typically erupt in around 5 or 6 months of age, but teething starts 3 to 4 months of age.
Right. And you were saying earlier before the show when we were chatting something about the milk that causes cavities. How does that happen?
So breast milk, formula milk, any kind of milk has sugar in it, and the dental cavities, the type of bacteria that cause cavities, they thrive on sugar. So if babies are being breastfed or even being bottle fed, if we're not wiping and cleaning off the surfaces in our mouth, then they're being exposed to the bacteria that can break down the teeth and cause dental cavities.
Right, and as a new parent, you don't really think about these things.
Yeah, there's so much going on. That's the last thing you're thinking about is wiping and cleaning the teeth. Yeah.
Right.
That's why we recommend, our American Academy of Pediatric Dentistry, we recommend kids to come in for their first checkup when the first tooth comes in or by their first birthday, ideally.
Okay, that was my next question, so you answered it.
Okay.
Awesome. All right, so my next question would be about thumb sucking. So a lot of kids at some point start sucking their thumb. What triggers it, what causes it, and what should a parent do?
So it's a coping mechanism for stress, and their stresses could be anything. You know, it could be just what they're going through, or that they're cranky or fussy or whatnot. One of the stresses is teething. So when the teeth are about to erupt in, they're going through a little bit of pain, and that sometimes is when the thumb sucking habit first starts. And it's a very tough habit for some kids to let go of.
Right.
So there's different approaches to treatment. Do you want me to talk a little bit about that as far as the thumb sucking? Yeah. So when we first catch thumb sucking, if it's very early on, 0 to 2 years of age, I tell parents to just try to remind them, like, hey, it's not a good idea. And kids do great with pictures. So showing pictures of bunny rabbits and how their teeth are flared out.
Yes.
That's such a great way to show kids, hey, this is why we don't suck our thumb.
Otherwise, you're going to end up looking like a bunny.
Yeah, we don't want to look like a bunny rabbit. So kids are very visual.
That's a very good idea.
So because if you just tell them don't do it, they're going to do it more. And what I've noticed is the more you stress it, sometimes they do it even more because
they do the opposite.
They do the opposite.
Right.
They're trying to cope with their stresses. And growth is a type of stress as well. So the kids are growing right at night. There's so many factors going on where that's why kids suck their thumb. Some kids grow out of it, and some kids need a little bit of habit therapy or an appliance down the road to stop the
So
habits.
who does that? Do you come to a dentist or you go to any other medical professional for that?
Yeah, so oftentimes pediatric dentists and general dentists are the first ones to catch the habit. We first try to talk to the parents, talk to the kids about how to stop these habits conservatively. But then at a certain point, once they're 3 and 4 years of age and it's still continuing, it's a good idea to talk about habit therapy. And usually a speech pathologist who is well versed in how to stop these oral habits is the first person I refer out to. I don't recommend appliances on kids when they're that young But say the kiddos are 7, 8, 9, they're much older and they've tried habit therapy, then orthodontists can use appliances that physically stops that habit.
Well, that's good to know. We're in conversation with Dr. Abhishek Bhaumik. He's a pediatric dentist, and we're going to take a break here. Stay tuned. Welcome back to Health Talk. We're in conversation with Dr. Abhishek Bhaumik, and we're talking about pediatric dental health care. My next question would be, what gum diseases do you see in children commonly?
So I'll start off with saying that gum disease isn't very common in young children, but a certain type of bacteria that thrive in our gum tissue, and if kids aren't brushing and flossing over a period of time, this will eventually lead to gum disease when kids are teenagers and adults. So it starts off with just bacteria that sits around the gum line of our teeth, and it's simply due to food being stuck in the area. So if kids aren't doing a good job brushing and flossing, this bacteria will thrive and grow. Eventually the gums become so inflamed, red and puffy that the bacteria starts physically damaging the gums and loosening up the ligaments that hold our teeth in place. Mm-hmm. So our teeth are scaffolded by ligaments that it's held in place into the bone. Mm-hmm. So the specific type of bacteria that cause gum disease, they really affect our gum line. So, and then eventually, if it gets so bad that we're not able to control this bacteria, that's classified as periodontal disease, gum disease. Mm-hmm. So fortunately for kids, they don't get a lot of tartar and calculus, but it's important for us pediatric dentists to catch these early on, signs of it. And if we do, we need to help kids correct it so they don't end up with gum disease.
And the only way you can catch it is when parents actually bring the kids in every 6 months for their regular checkup. So that's very, very important. कि हर 6 महीने में आप चेकअप के लिए लाएंगे, तभी ये सारी चीजें जो हैं वो early on catch हो पाएंगी. My next question would be, I've heard a lot of parents saying that their kids grind their teeth in their sleep. How commonly do you see that, and how do you treat that?
So it's very common for kids to grind their teeth at night, and there's a few physiologic things that's going on why kids grind. One of them is physiologic growth. So all of our kids are growing at night. So part of that growth involves our adult teeth and our jaw muscles. So when those jaw muscles are developing, the teeth are shifting around. That's part of the reason kids grind. So their bite is actively changing, and that's one of the biggest reasons why kids grind at night. Second biggest reason, what a lot of us pediatricians, pediatric dentists believe why kids grind is allergies. When kids are really congested, they tend to grind more at night.
Wow, our brain, I had no idea.
Yeah, so our brain is
interesting.
Trying to actively, in some way, try to wake us up from a deep sleep by grinding on a subconscious level. Oh, so that's another thing you'll notice. Our kids that have really bad congestion certain times of the year, they're going to grind more than ever.
Oh, okay. Is it genetic?
It's not. I wouldn't say it's genetic. It's a normal phenomenon that all kids go through. Okay. Eventually, it will stop though, and that what I notice is around 8 or 9, when there's enough adult teeth, around 8 years of age, there's enough adult teeth coming in. That's when the grinding starts to slow down, and it sounds like a chalkboard mark, like nails on a chalkboard.
Right,
it's very loud. It's very loud. Yeah.
Yes.
But it does go away on its own. It's different than adult grinding. But,
so does it create enough damage for the baby teeth to be able to?
That's such a good question. I get these questions all the time. So no, it's going to cause some wearing of the baby teeth, which is fine. We're meant to lose these baby teeth anyways. What we're looking at as pediatric dentists is grinding and wearing of the adult teeth. Okay. So when kids are 6 or 7, they're already going to have a few adult molars in the back and those front adult teeth. Most of the time, I don't see that issue. For some older kids, their grinding habit is so bad, they're clenching, their jaw muscles are tight, the TMJ joint is sore, and if they're wearing down their teeth, then we need to talk about a night guard and take a look at their bite. So myself and orthodontist, we work together to determine why are they going through this. Sometimes it could be an airway issue. If they're not getting good oxygen airflow into their brain, that's a reason for older kids to grind.
Okay.
Even young children can grind because of an airway issue. Going back to allergies and congestion.
Right.
Yeah.
So is it like a good way to, let's say if your kid is grinding teeth a lot, you should go to a pediatric dentist and make sure that there's no bigger underlying issues.
I'll say this. I think some of us pediatric dentists are now really understanding the value of airway and understanding and looking at the throat, looking at the tonsil size, asking the appropriate questions, how is the child sleeping at night, because it is a big factor of overall development, and connecting it to grinding, that's the reason why kids grind, if they're not getting good airflow into their brain.
All right.
Yeah.
Well, my next question is bed breath.
Bad breath, yes.
Do you treat those children? How commonly do you see them?
It's very easy to treat when kids have bad breath. There's a couple reasons why. One is just bacteria, plaque, food that's stuck along the gum line.
Okay.
So really cleaning the gums, flossing the gums, flossing the teeth, so getting the food and bacteria out. Second location where bacteria thrive on is our tongue.
Okay.
So the tongue and the gums are some of the most common areas where the type of bacteria that cause bad breath kind of stay around. So brushing those areas is really important. Hygiene. The other thing is diet. If kids are allergic to a certain food, dairy for instance, or gluten, that's a more rare one, their upset stomach and reflux will also cause bad breath issues.
Okay.
So really, I do that. I ask some questions about the diet, what's going on.
So it's more like an elimination process. So
Exactly.
the teeth is clean, everything is good, and
must be something in the diet then.
Okay.
Yeah.
Got it. Okay. Well, that's very good to know. एक और कॉमन इश्यूज अक्सर ये होता है कि बेबी टूथ जो है वो ओवर रिटेन कर जाते हैं, यानी अपनी जगह से हटते नहीं है, और नीचे वाले परमानेंट टूथ जो है उनको आने की जगह नहीं मिलती है. So what do you do in that case?
So it's relatively common if the baby's tooth is still there and say the adult tooth is right behind it or off alignment, we look at the child's age. If it's within the general timeline of that baby tooth to still be in the mouth, we don't do any treatment. But say the child is older and that baby tooth should have already fallen out by then. Right. I look at the bite, I look at seeing how much crowding there is, and then I generally make the recommendation for us to help the child get that tooth out of the way. And then typically for the bottom teeth, the tongue will push those adult teeth forward. So the alignment will self-correct itself within 6 months to a year. But for the upper teeth and other parts of our mouth, for over-retention, I look at the bite again and see if there's going to be future crowding issues. At that point in time, I start working with an orthodontist to make that call, whether we should start taking more baby teeth out or should we just let time take its course and let the baby teeth fall out on their own.
Well, here we're going to take our next break, and we're going to see you after the break. Stay tuned. Welcome back to Health Talk with Nausheen Milbrat. We're in conversation with Dr. Abhishek Bhaumik, who is a pediatric dentist. Our next question is, sometimes some of the baby teeth are in wrong spaces, या उनकी direction गलत होती है या alignment सही नहीं होती है, तो ये हम जानना चाहेंगे कि उन cases में उन बच्चों का treatment कैसे किया जाता है?
We look at the child's age first. So depending on the child's age, and we also look at the number of teeth. If there's multiple teeth that are out of alignment, I start working with an orthodontist. I think it's really important to work together with an orthodontist because we're going to be managing not only how the teeth are coming in, but how to make sure that those eventually all the adult teeth are aligned perfectly. So for early on, if it's just 1 or 2 teeth, I don't try to stress parents out. We just wait and watch. But as kids get older, if many teeth are out of alignment, then I start working with orthodontists.
Okay.
And they usually guide me on which baby teeth we should take out to create more space in order to bring the other teeth into proper alignment.
Right.
Yeah, so usually early orthodontics and braces are involved for those situations.
Okay.
Yeah.
So does it really affect the speech development or feeding? Does it create any kind of feeding issues for the child?
Believe it or not, it doesn't. Yeah,
Okay.
most of the time it doesn't. Kids are very adaptable and they compensate really well. So to give you a perfect example, a lot of kids will be missing their front two baby teeth right around 7 years of age.
Right.
And they'll have gaps in those teeth. And sometimes it can take up to a year for the first set of adult teeth to come in for those two spots. So you would think that the child's speech would be a little strange and off,
Right.
and it might be for 6 months, but then as soon as those teeth come in, they adapt and pick up and how to pronounce certain letters and words properly. So most kids adapt really well and they don't have any issues with eating or speech. Yeah.
Got it.
Yeah.
Well, my last question for today would be, what is a good way of building a good routine that parents can build right from the beginning for good oral health care?
Sure. And I think the main thing is starting very early and young and incorporating and stressing the importance of it. So early on, when kids are 0 to 2 years of age, parents should be the ones doing the brushing 2 times a day, morning and night. So the fact that they're undergoing the brushing 2 times a day that early on in age, they understand that this is a habit and routine we have to continue. And then once kids are 2.5 or 3, they're going to want control of the toothbrush. I think you're going to notice it time and time that they want full control.
Yes.
So the best thing to do is let them play with it. And then after they play with it, just stressing it, okay, now it's my turn to help out and get those back teeth.
Right.
So
you finish it off. You just don't let them do it.
Exactly. It's
Yeah.
so important that we're always monitoring and helping with the brushing all the way up till their teenage years, honestly.
How do parents
Yeah.
make it fun? Like sometimes, kids don't want to brush their teeth.
Yeah.
So what advice
So
would you give
there's
them?
different ways you can make a game out of it, or something simple like a prize, like stickers. Kids are obsessed with stickers.
Yes, like a reward system.
A reward system, yeah. So if they're willingly wanting to brush 2 times a day, they earn a sticker or something small.
Right.
Not making it something extravagant or big, but just showing them this is something we all have to do, and it's required to do. I find that the parents that struggle the most is when they don't stress it and maybe they're not doing it every day or just doing it once a day.
Right.
That's not enough for kids to understand why later in life they have to brush 2 times a day. So by starting early and then starting also early visits at a pediatric office, they'll interact with us, somebody who's not part of their family, right? Then they understand, okay, multiple people are telling me that I really
like
need
a
to take care of my
reinforcement.
teeth. Yeah, it's a great reinforcement, and we can kind of show kids pictures and videos while they're at our office, and we have fun toys and props to show them how good they're doing with their brushing. Something that's fun, what we do at our office is we always take camera pictures of kids' teeth. Zoomed in camera pictures so they can see exactly where they're not doing a good job brushing.
Oh,
So the
okay.
older kids love that. So when they come
Yeah.
in, they want to try to impress their parents and show us that they're really doing a good job.
Right.
So hopefully that answers your questions of building early habits with the parents, monitoring everything, and frequent checkups is really the only way to continue making sure our mouths are healthy.
Awesome. Awesome. Well, this brings us to the end of the show today. Thank you, Dr. Bhamik, for joining us today. This was great information.
Thank you so much for allowing me to do this. Thank you.
If you would like to consult with Dr. Bhamik, his information is mentioned on our screen. CDC के मुताबिक जिन बच्चों में ओरल हेल्थ इश्यूज रहते हैं वो न सिर्फ स्कूल मिस करते हैं बल्कि उनके उसका असर उनके ग्रेड्स पर भी पड़ता है. So set your children up for success and take care of their oral health right from the beginning. Send us your comments and suggestions to info@bosa.tv. This is Nasheen Mulebread signing off from Health Talk. Until next time, ciao.